one of the core tenets of like being more neurodiversity affirming is like exploring it from a strengths and challenges standpoint, as opposed to deficits and here are all the things that you're not excelling in, that you should be by, I don't know, whose standard? My standard as the assessor, or society standard. As you start to do your own research, you'll read things and you'll get a sense of like, oh, this feels more affirming, this feels more in line with what I'm looking for, and you can pay attention to the things where it's like something's not quite right here, right?
Yeah. I really appreciate you joining us.
Either work or kid related.
Why is this happening? What does the child need to express themselves?
How can we help understand them? Here's a way to look at autism in which your child is not a problem that needs to be fixed.
That's that shift in language that's so important.
Hi everyone, welcome to our Feeling the Love podcast with Big Heart Toys. We are so excited today to have Mady Snyder, a licensed family and marriage therapist, who's going to be talking all about autism and mental health. So join us now as we begin.
Sounds good.
Hi Mady,
Hi
how
there.
are you doing today?
Good. How are you?
I'm doing great, thank you.
Good.
And I just wanted to ask you a little bit about what you do and what your role is.
Yeah, so I'm a licensed marriage and family therapist, and I work with individuals, couples, families. I work with people across the lifespan, so I kind of do a variety of things, and I specialize mostly in working with neurodivergent folks, specifically autism and ADHD, and then I also support neurodiverse couples and families. So yeah, I'm kind of one of those therapists who likes to work with adults and
that's
kids.
Awesome. So you get to see a lot of everything, it sounds like, which is amazing. And I just wanted to know, how did you get into this field? What kind of inspired you to work with this population and in this profession? Yeah,
I majored in psychology in undergrad, and that was kind of inspired by my own life experiences. And I grew up in an area that was pretty remote, and there wasn't access to mental health care, and was made aware of that kind of at a young age. And so it inspired me to be curious about why that is and what I could do about that. And ended up majoring in psychology and then getting a job out of high school working at out of college working at a autism clinic. And from there decided that, a lot of times we were treating just the individual child we were working with, but I also saw a lot of parents and families who were struggling. Yeah. And so I from there decided that we need to treat this kind of as like a family problem. It doesn't just affect the one child, it affects siblings, it affects parents who are stressed, and so that's inspired me to pursue my degree in marriage and family therapy.
I think that's awesome, and I would love to hear more about the family aspect of it. You say it impacts siblings, and what does that look like?
Yeah, a lot of the siblings that I work with, and I've done some research on how autism impacts families as well. A lot of times for siblings, there's a sense of they have a sibling who maybe requires a lot of attention, a ton of appointments, right? Maybe sometimes even parents are spending more time with that child because they're having to take them to all these different appointments. Right. Their speech appointments or occupational therapy or other therapies that they're doing. So there can sometimes be children who maybe feel like, I have to keep it all together because my other sibling's really struggling, or I'm not getting enough attention, so I'm going to act in ways that will help me get that attention.
That's very interesting. Yeah, that's, I think, a really important point is that exactly what you said, feeling like, oh, this child is getting more attention. You don't understand why that's happening. Yeah. And do you work with siblings one-on-one or the whole family as a unit typically?
I can work with the whole family as a unit. A lot of times I end up working with them one-on-one. Okay. I find that a lot of parents have so many places that they're taking their kids to. Again, a lot of times when you have a child who's neurodivergent, they have so many different kinds of appointments. Yeah. And so a lot of times it's hard to get the whole family. Okay. And so most of the time I'm working with siblings one-on-one who are processing their experience with their sibling who's autistic or ADHD.
Okay, that's amazing. That's very interesting because I feel like a lot of what we talk about is just the child, and you're bringing in the whole family, making sure that every piece fits together and is kind of taken care of. Everybody understands what's happening and is processing together. So that's really cool. I appreciate you sharing that. Yeah. And then just for our parents, And caregivers who are listening, could you talk us through the evaluation process, what sessions then look like, how you develop goals with your patients or with your families? I would love to know more about that.
Yeah, it can often be really complicated and confusing for families.
Yes.
The whole process. Usually they'll go, they'll notice something and maybe take their child to the pediatrician, and then the pediatrician will say, well, here's a referral to someone who can provide an autism evaluation. Sometimes it's like regional center or through insurance. A lot of times what I find is there's kind of like with those referrals, it's almost as if like these are the only options I have. And so I think for a lot of families, there's just like a lack of information around different modalities or therapies or things that are available.
Yes, absolutely.
So yeah, there are different, you don't have to always go with the evaluator or the assessor that's recommended to you. You're allowed to do your own research. There's also limitations of insurance sometimes where you have to go through a certain provider, but there are opportunities to find like a provider or usually it's someone with a PhD or a PsyD, a degree in psychology, that is evaluating you for autism. And so you can look up those degrees in people and read their bios and see what they're passionate about and choose someone who feels like a really good
who feels like
fit.
You can connect with and relate to and their understanding. And that reminds me, we've had a previous conversation and you mentioned helping families find neurodiversity affirming providers and how that is kind of a passion point for you.
Yeah, definitely.
Yeah, so first of all, I just want to kind of ask you what does that phrase mean as a whole for people who've maybe not heard of it or kind of like, oh, I can't really figure out exactly what that means. I'd love for you to start there and see what is that.
Yeah, there's a lot of emerging terminology for people.
Yes.
And it can be hard to navigate because we have like a lot of research for certain modalities, but there's also a lot of emerging research that shows that there's things that are promising.
Yes.
And a lot of times the things that get funded are just the things that have been researched the most, which doesn't always equate the thing that's most effective, right? So it's very nuanced. All that to say that when we talk about like the neurodiversity affirming approach, it's like this newer emerging modality that's coming out of the idea that everyone's brains are designed uniquely. All of us are neurodiverse, right? We're all biologically diverse, and there are some people whose brain is divergent. So maybe the majority of people, their brain operates in one way, and some people, their brain diverges from that norm.
Sure.
And so then within that neurodivergent umbrella, we have things like autism. And people with autism, all of their brains tend to work in similar ways. Again, no two being the same, but maybe they have a lot of the same struggles. And the same for ADHD or OCD or all these things, right?
Yeah.
So this idea that autism is not something that's like bad or a problem.
Yes.
It's just a natural variation of our brain.
Changing the language around talking about it, which is hopefully what we're doing now.
Yeah, so trying to create this idea. I think in the past it's been like, oh, it's something we need to cure, something we need to get rid of, and instead maybe the problems aren't always the behaviors themselves. Sometimes they're problematic for other people, but most of the time people are just struggling with the ways the world isn't designed for them. Yeah. And that's where problems are emerging from.
Yes, and I've been hearing the term an holistic society as well, and how, just like you said, the world's not really built to be inclusive to everybody. And I'm wondering what you think the role of stigma is in all of this, because like you said, it's not a bad word. We're trying to talk about things and make everything feel better and inclusive. And what do you think about stigma and how that plays a role in your families?
Yeah, I think for a lot of families, I think things are shifting overall, right? Like when at least for me, where I grew up and when I grew up, mental health, again, just like wasn't as accessible. And it was like, oh, that's just if you're like really severe, right?
Exactly.
And so I think in that way it felt very othering for people if you are pursuing therapy or if you do have a child who's autistic. I think in that way it felt, stigmatizing. Absolutely. I think a lot of that is opening up. I hear a lot of people talking openly about therapy now. A lot of the kids I work with are like, oh, it's cool I have a therapist. Brag about them on the playground. I was talking to my friend about my therapist. And so I think a lot of that is opening up, and that's what's allowed us to shift from like, how can we even further that progress and say that some of these things cause deep pain for people. Sometimes kids have really intense sensory systems that lead to them maybe being aggressive or some of those things can be painful to people, but again, how can we approach it in a way where we're saying where we're having empathy and understanding. We're not saying like, let's get rid of this. We're saying let's understand it instead.
Yeah, and I hear you saying let's understand it. That's a huge part of, I feel like, my role as a speech therapist working with kids. Like, okay, there's a tantrum. You know, we hear a tantrum all the time. They have tantrums or XYZ behavior. And it's like, okay, well, we need to first uncover what's going on. Why is this happening? What is the offset? What is it communicating? What is the thing that we're trying to say? And not just diminishing that as a whole. So it's like, okay, if I'm feeling stressed and I am, fidgeting or stimming, for example, then we're not going to get rid of that behavior. Yeah. We're going to provide supports for it instead, right?
And that's a huge shift. It hasn't been that way.
No, it hasn't. Especially, lots of therapy centers still will focus on diminishing those behaviors instead of either accepting them or finding an healthy equivalent. I would love to ask you, just for people who may not be familiar with it, what is stimming?
Yeah. So stimming is a behavior that people generally do. There's a couple of different ways to understand it. Usually it's a repetitive type behavior that people do. And the idea is that it's regulating in some way or expressing something. Sometimes for people it might be like expressing even like a nervousness about them. But it's usually like a behavior that someone is doing. In the past it would maybe be seen as like something to eliminate. Whether it was like... a repetitive movement like hand flapping or any other kind of repetitive movements you can think of body-wise, right? Or maybe even just moving your body in ways that before we'd say like, oh, that's abnormal. But now it's I think there's a lot of understanding that it's understood as like a more regulatory behavior, right? Like, this feels good to me. Much like if you were like, oh, I really like going like this to my arm, it feels good, or I really like playing with my hair, right?
Or I'm a foot tapper.
Yeah, or a foot tapper.
It's going right now.
And I think also the trust that like it's not bothering you, right? And if it's bothering someone else, maybe we teach them how to advocate for their own needs rather than you having to change your behavior to meet other people's needs. I like how you said
that. Yeah, that's awesome. Yeah, so more as you're again putting the responsibility on others as well. It's not like, let's see what we can do to alter this child. Right. Tell them what they're doing is not acceptable, but hey, how do we instead look at this from a different angle and perspective, and let's be aware of that. And that's, I think, really, really important right now. And fortunately, it seems like we're slowly starting to get to that place. So, I appreciate you sharing that with us. And then I think the next thing I wanted to ask about that kind of relates to that. As we listen and work to amplify autistic voices, we're learning more about masking and the potential trauma that individuals experience. So we're hearing a lot from autistic adults who are coming out and saying, hey, I'm discovering this and it has not been healthy, and we're starting to learn more. So what's your experience working with individuals and helping them unmask? Yeah, and masking behavior, when we talk about that, there's like a few different behaviors in that realm. So there's like masking and camouflaging and compensating and these kinds of words, right? That are usually like, there's some way you learn socially that if I act in this way, there's going to be like a negative social consequence, right? For a lot of people who are assigned female at birth or socialized as female, there can be a heightened sense of that, a heightened sense of awareness of social consequence. And so I think a lot of that can contribute to why the autism diagnosis is really underdiagnosed in females and women. All of that to say, like,
there's a lot of nuance around masking, but generally it's like this sense of I have to kind of put a mask on in order to interact socially with neurotypical or neuronormative society. We don't see masking behaviors as much in maybe two autistic people talking or interacting, or two autistic kids playing. That masking is not going to be as intense because their communication style is the same.
Yeah.
And so, yeah, again, there's a ton of nuance in there, but this idea that, like, in order to interact or to be socially rewarded or to experience positive social relationships, I have to act in ways that are actually really uncomfortable for me, actually really physically and emotionally painful, or just super draining. By the end of the day at school, I'm exhausted because I want to be able to sit and stand when I can, and I have to sit at my desk all day. Or I want to be able to, whatever this, behavior is that would be regulatory for them.
Exactly.
Toe tapping. A lot of times, teachers are like, don't tap your toes or whatever.
Still bodies.
Yeah, exactly.
Calm bodies.
Yeah. Or like, moving your hands in ways. And so
a
lot of the classroom can be demanding for kids in that way of like, you can't move your bodies in ways that feel good for you. And so all day long, all of your energy is devoted to how do I follow the rules?
Yeah.
And we can see how that follows you through adulthood, right? Say this thing, don't say that.
Absolutely.
Small talk, right? When you pass someone on the street and like, hi, how are you? You're supposed to say, hi, how are you? Not
exactly.
oh my gosh, my day is so exhausting. Here's what's going on.
Yeah, we don't actually want to know how your day is.
Yeah,
how
so I think for a lot of parents, listening to autistic adults, and learning, where are we going, but also what have the modalities been in the past? What were the things that some of these adults struggled with as kids? Are there ways you can listen to them and learn from them?
Absolutely.
So I think, because some of this stuff was not as prevalent for these people who are now adults.
Yes, exactly.
So I think that's an important piece of it too, is understanding it from people who have gone through it already. It's really important for kids who are neurodivergent to have relationships with people who are older than them who are also neurodivergent, or other neurodivergent kids.
And so how you say it's important to have relationships with older individuals as well. How does that look? If a parent was hearing that, what do you think how would they make that happen?
I think even if it's consuming materials, right, from autistic voices, whether that's social media. I actually recommend that a lot because everyone's on social media.
Yeah.
So if you're going to be on there, let's throw a few resources in there too. Absolutely. So if you have a teen who's on social media, or there's so much information on YouTube these days, that's right?
True. Yes.
Or even books written by kids who are autistic or adults who are autistic, kind of showing people and expanding the world that when you get an autism diagnosis, it's not condemning you to some sort of, fateful future that is negative.
Absolutely.
There's options for you, and it opens up, it's okay to be how you are. And maybe in being how you are, you'll be able to follow your special interests or your natural abilities, and that will lead you to creating something incredible.
That's amazing. That's a very beautiful sentiment. And I'm just thinking, as you're saying that, be how you are stands out to me a lot. And I'm wondering, because we still do live in a world where there is stigma and there will be negative reactions sometimes. And unfortunately, that's, it's not fixed at this point. But for parents who are, wanting their children to be happy, healthy, cared for, loved, accepted, is there any advice you typically give to them, to navigate this?
Yeah, definitely. Yeah. I spend a lot of time talking about this kind of stuff, right? How do you create a safe environment at home?
Yes.
And also help your kid to thrive in other environments. And so I think part of that is understanding that, masking is something that it will be inevitable for kids. It's something they're already learning. And so there might be times where that's really beneficial and it's something that keeps somebody safe, right? Maybe that's when you're in the classroom or in a social situation, maybe there's times it's going to keep them emotionally safe, right? So it's learning when do you want to employ that skill or not, so it doesn't become the only thing that you have available in your tool belt. How can we expand out what other tools are available to them.
Yeah, and
So
what feels good.
Yeah, and what feels good for them. And maybe masking doesn't feel good, but there's a time that it might socially benefit them.
Okay.
Right?
Yeah.
Like in a job interview, for example.
Right.
It's being able to help them start to advocate for themselves, start to assess like what makes an affirming environment or not. Where am I emotionally going to be safe or not? I think a lot of it is like building in those skills and helping parents instill those in children, and that's going to change as they develop, right? And as they start to understand different concepts. So it's kind of like at every age you're figuring out what's the version of that.
Yeah.
Right? And so like it might be beneficial to share, because then a friend might want to play with you more. So maybe that's a skill you want to teach, but maybe at home they don't have siblings, so they don't have to share.
Right. And that's a big one we focus on in speech therapy a lot. It's like the very like regimented, okay, now we're sharing, now we're, you know, that because that's what's acceptable, right? We've learned about stigma, we've learned about masking, and I just want to ask you, how does this play a role in mental health? What is the intersection between mental health and autism, or mental health and neurodiversity?
Yeah, I think what we're learning are like, what are the impacts of feeling othered or isolated? A lot of the experience for if you're raising a child with autism is these maybe subtle indicators of like, I feel like a little bit different, or it feels like everyone else is kind of picking up on something that I'm not getting, whether it's a joke or someone speaking in metaphor rather than literally. So there's these micro moments, right? It's not always big ones, just like these very subtle moments, because kids are constantly learning, right?
Absolutely.
So they're picking up on these moments where they maybe feel isolated. A lot of kids are, bullied for being themselves, and so they learn, okay, I can't be myself, so I have to try to be this other way. So when we look at like all of this and the long-term impacts of that, a lot of the clients that I see as adults are processing these experiences, and we talked a little bit about trauma earlier.
Yes.
It's traumatic to feel alone, isolated, othered, different, and to be chronically like experiencing negative consequences for acting in ways that feel natural to you.
Yeah.
And so, it's like not always huge moments. It's a lot of micro moments that lead up to feeling that way. But thinking about that for kids, right? Again, helping them find environments that do affirm who they are. Whether that's friends who they can be themselves around, or resources you're exposing them to. We're thinking long term that the impacts of that are going to be, trauma responses, or anxiety, or depression, or sometimes OCD that gets really intense.
And I hear you say trauma response, which is something I've been looking into lately, and I wanted to see if you could kind of explain what that is exactly. I know it very much relates to what you were just saying.
Yeah. So when we think about trauma, a lot of times people might think about like a big T trauma, as we would call it, like a car accident, or an assault, or experiencing violence in some way, or these big traumas that we think about, right? There's also like, one of the ways I think about it is like there's small moments, like emotional traumas that can happen with a parent or with a friend, right?
Yeah.
They're not always these big moments. Sometimes it's like, my mom forgot to pick me up from school, right?
Yes.
And that's when I had my first panic attack, because I didn't know how to get a hold of her, and I was really worried, right? So it's not always like these big, there's these moments that are smaller, or like someone wasn't there for me in a way I needed them to be. So when we think about trauma, that's kind of what we're talking about. It's not just these bigger experiences, but like I always felt alone as a kid, or I felt bullied. It can be smaller experiences.
And they compile over time too.
Yeah, and they can become compounded, right? A lot of these moments adding up to like, I just don't feel like I'm worthy of being around anyone, or I feel really alone. And then you get into a relationship with someone who exacerbates that, right? So when we think about that, like for kids, and there's a few different ways we can talk about trauma responses. I think one that would be helpful is thinking about this idea that we tend to all have this like window of tolerance where we're feeling calm, grounded, and neutral, right?
Right.
It can be like anything from like a flow state to just like, I feel pretty neutral right now.
Okay. Mm-hmm.
And sometimes what a trauma response can look like is I get bumped out of like what I can emotionally regulate and tolerate. And that can be like screaming, crying, getting really angry, right? Having like an outward outburst. Or it can look like I'm going to kind of numb myself out. I'm going to disconnect. I'm going to feel depressed. So that would be like you're down regulating. And that would be like what we would call hypoarousal. And then at the top of this window of tolerance would be hyperarousal. The idea is like, how do we help you stay calm, grounded, and neutral? Not that that's going to be all the time, but when you get bumped out, how can we help you get back to that state, right? So when we think about trauma response, it's not always, we can talk about like, the classic would be like fight or flight, right?
Right.
And there's actually like a bunch of other F words, a bunch of other F's that go along with that. Freeze, tend to befriend, all these different things.
Perfect.
But all that to say, like, that's what it can look like, you know, in kids, is like I am bumped out of that state where I can no longer regulate and get back to calm, grounded, and neutral.
Okay, I think that's a really interesting way to look at it for people who are not familiar with that, because, you know, being neutral, it's just you're calm and you're feeling regulated.
Yeah.
Not overstimulated, not, you know, you're feeling okay. And that's...
We're not going to feel happy all the time.
No, and
right?
that's okay.
That's not the goal.
Exactly.
It's even like, you know, if I have people who've been through really traumatic experiences, maybe we're not going to get you back to calm. But maybe we're going to get you to like neutral.
Okay.
And so maybe sometimes that's the goal too.
Okay. Yeah, no, I think that's really awesome. And so I heard you mention relationships and how people may even find themselves in a relationship that can feel like it's exacerbating some of the trauma that you mentioned. And I would love to learn more about your work with couples too, and how you help relationships.
Yeah. So a lot of the couples I'm working with, you know, are parents themselves, right?
Yeah.
So there is, I think it's really important for, like, if you have a child who's autistic, you need like your own place of support. You're caring for like your kids, you're pouring yourself out, but you also need a place that's like just for you.
Right.
Whether that's your own therapy or couples therapy. A lot of it's really important to like think about your parenting values too, right? And so some of the things that are processing sometimes with couples are, what's the dynamic here? What are your past wounds from either previous relationships, from your own families of origin? Let's explore intergenerational trauma. Like, if we look at your family tree and we see like your dad struggled with substance use and his grandfather struggled with substance use, and so because of that they were unavailable, and so here's how you've experienced relationship, or here's what love means to you, here's the story you were passed down from your family.
This is what I'm used to. This is what it looks like to me.
Exactly. And all of that's what you're bringing into your relationship, and then to your relationship with your child, right? So we can see how it's really important for you to have a space to say, why is it that I'm interacting with you in this way, right? Why is it when you don't pick up the phone when I needed you, I'm getting really dysregulated, right?
Right.
And what is that communicating to my child then? Because your children can feel when you're dysregulated, right? They pick up on it from the moment that they're born.
Yeah.
And attachment really, when we think about attachment in the therapeutic sense, we're saying like, how is it that I feel in relationship with you? Is it feeling like you're there for me most of the time, or is it feeling like when I'm needing you, you're unavailable, or am I like really, really preoccupied with like, I always need you to be there for me to feel good?
Yeah.
So again, we're thinking attachment starts from the day children are born, maybe even before that in the womb. And so it's really important to explore that in the parental unit, and then also how that translates to relationship with children.
Yeah, absolutely. I think that's all so important, and I feel like just hearing everything you've said, it's about healing. It sounds like a lot of the work that you do is healing and focusing on what brought you to a certain place and what can we do. So I think I'm wondering now, if we have parents listening to this, what is some advice that we could give to them as they're navigating maybe a new diagnosis or they're just unfamiliar with everything that we've been speaking about?
Yeah, I would say be curious. That would be like one of the big ones from the get-go. Be curious about your own responses to things, but also like when you go to an appointment with your child and they say like, here's the recommendation or the referral, be curious about that. Like do your own research, develop the skills to advocate for yourself, model those skills for your child so they learn how to advocate for their own needs. And I think as a parent, some of the best work you can do for your child is on yourself. And they're learning from you constantly. And especially if you think about like those early years before they're spending the majority of their time at school, like you're the model for that.
You're
and
with
so,
them 24/7, basically.
They're learning from you. And so again, I think some of the best work that you can do is on yourself, being curious about your own reactions, and fostering curiosity in your children.
Okay, that's amazing. I love that. And I'm wondering if we are thinking about research. I know that was kind of a great wrap up that you just said. That was amazing. I had just one more question that I was thinking of. In terms of research, what do parents need to look for? If they get a recommendation from a specialist and they're like, okay, you know what, I'm going to do my due diligence and make sure I feel good about this choice. How do they do that?
Yeah.
What do they look for?
Yeah. So there's so many different ways we can go with this. Because I'm really right now, I kind of go through phases where I get really interested in something. And I get really curious about it and do a lot of research myself. So all that to say, right now for me, that is value. So I think one of the things you can do is sit down with your partner, with yourself, and say like, what are my values as a parent? For some people that might be like, I really value productivity and efficiency, right? So maybe that's the value you're going to look for in a provider. How long is this going to take? You have to have a fair assessment of like, what are the resources we have available? Maybe your value is like, I want someone who is going to be really affirming of my child in the ways that they are and not be seeking to change that, right? Maybe you really value acceptance. So I think one of the best things that you can do is, they have different resources for like values oriented or exercises online, but sitting down and saying like, what are my values, and then how can I search for that in a provider? Because I could sit here and say like, you can ask this question or that question, but those values are going to be different for each parent.
Absolutely,
right?
That's very true. Every family, and I like to tell my families this when I'm working with them, like, you know, when you're working on whatever, it doesn't matter if my opinion is, oh, this is what a child should know or be good at. It doesn't matter, because every single family has their own culture, their own opinions, their own values, just as you said. And I think it's empowering to find out what is important to you and figure out what you need. Yeah.
And we can also say, like, I can say, here's my clinical experience, right? Here's my clinical opinion. Here's what I have, here's the research I've done, right? And then now you go do your own and see, compare that, right? So I can only use like the experiences I've had with clients and here's what's worked for the people I've worked with.
Right.
I do think there's a lot of value in finding, again, like people who are neurodiversity affirming, which is basically like, what kinds of tests are they going to do for your child? What's their approach, right? You can ask you can call people and ask them, what's your approach to assessing autism, or what their passions are. There's like all kinds of questions you can think to ask. Absolutely. But you can kind of figuring out what's important to you, and then how can you ask those kinds of questions.
I really like that. And going off of that, I'm wondering, what would a neurodiversity affirming evaluation look like to you? What do you think? Like when you're with your patients, what do you do? How does that look?
I look for like non-pathologizing language, right? Okay. So if we look at the DSM diagnosis of autism, which is a lot of times what someone needs to have in order to get services, and the DSM is like what we use to diagnose someone when they come to us. It's our diagnostic manual.
Sure.
And so if we look at that diagnosis, a lot of the language is like deficits, right? So it's like deficits in social and emotional learning, or deficits in it's a lot of deficits language.
Yes.
So one of the shifts now and one of the core tenets of like being more neurodiversity affirming is like exploring it from a strengths and challenges standpoint, as opposed to deficits and here are all the things that you're not excelling in, that you should be by, I don't know whose standard, my standard as the assessor, or society standard that says it's really great if you can be intelligent by, being very eloquent with your words or writing in certain ways, right? All these standards. So, this one of the shifts you can look for are they identifying here are the areas that are strengths for them, here are the areas that are challenges, or is it like, here's where they're deficient, and that's about it.
Yep.
So I think that's one of the things you can look for. Are they using that kind of language, strengths and challenges, or is it kind of you read it and you're like, dang, my child's not good at anything.
I know, and it can be extremely discouraging to have a report where you're like, oh, great. Yeah. That's nice. So, and it's not true either. Yeah. Because every child has individual strengths, individual challenge. Every child has things they're good at, things that are harder for them.
Yeah. So I think that's one of the main things you can look for is language, right? And as you start to do your own research, you'll read things and you'll get a sense of like, oh, this feels more affirming. This feels more in line with what I'm looking for. And you can pay attention to the things where it's like, something's not quite right here, right? Yeah. Even I read things sometimes and I'm not sure what. So I sit with it and then I ask my friends, hey, can you read this and let me know what something doesn't feel right. Does anyone else know what, is that happening for anyone else, right? So I think allowing yourself again to kind of be curious and say like, if you, get something from a doctor or from any kind of, clinician, another piece of like the neurodiversity affirming paradigm is that there's not a power dynamic between the provider and the patient. And so you're allowed to ask questions or you're allowed to disagree and then we can talk about that.
Or even help formulate your own goals a lot of the time, right? Like whether it's parents, caregivers saying, this is important in my household, my community, can we work on this? And you go, yes, we can. Like let's figure out how we can support you in that way.
Yeah, that would be another piece too. Are they treating like the client, whoever that is, whether it's you as the parent or your child, are they treating you as the expert of your own experience? Or are they assuming that I'm the expert in what I know, so you should do things the way that I decided?
Exactly. So one thing is like, you are the expert on your child. Nobody else. You spend every day with your child. You know them. You know what they like, want, need, etc. You know everything about them. And so it is kind of hard to feel like, oh, there's this therapist or person, whatever kind of therapist it might be, or doctor saying, this is what your child needs. It's very important that resonates, with your family. With you. Yeah, exactly.
And to take it a step further, what are your child's goals, right? When you have a child come in, okay, your parents bringing you in, that's their goal, but what's your goal? Like, what do you want to get out of here? Sometimes it's like, I don't want to be here. So then we do like more low demand tasks, right? Absolutely. Things where it's like, we're building a relationship, we're connecting, we're doing reciprocal communication, we're experiencing parallel processing. There's all these things happening underneath the surface and they might not realize by us doing an activity where we're painting together or
absolutely
planting a garden or whatever it is.
Yes. Okay, so one thing I want to ask you is, what is your favorite part of your job?
Ooh, a fun question.
Yeah, it's a big question.
I think one of my favorite parts of my job, part of it is just like I get to sit with people and talk with them, and people trust me with their stories and talk to me about things they've never talked about before, never told anyone before. And so I think I feel a lot of like reverence for that, or deep gratitude to be like honored with people's stories. But I also love that on the like practical side of it, I love the flexibility of what my job offers me, of being able to explore the areas for myself that I'm interested in. And I myself identify as like multiply neurodivergent and won't get into all of that, but that means like part of my process has been learning like, how do I work best? And it feels like in the job I'm in now, I have a lot of control over when I work and how I work and with who I work. I'm the CEO of my own company, and so In that sense, I like that I'm in a place where I get to see, when you're in an environment where you get to work how your brain works, how that can lead to like thriving, and how that can lead to feeling more empowered, and how that can lead to like a way of living your life where you're not constantly like just waiting for the weekend, right? Or waiting for your next break.
Where you're actually burnt out.
Yeah. Yeah. Because I don't think our lives are meant to be lived where you're just like constantly waiting for the next vacation.
Yes.
And, you know, we could talk about like self-care, for example, and how that, you know, is a big buzzword right now. And a lot of times it's not just like, you can't like take 10 bubble baths to get yourself out of burnout, right? This idea of like, are we constantly living our lives for when we get our next break? Or like, can a vacation be something that you enjoy but you're excited to get back to your work? And so I think that's been a really cool part of it, is like I get to do therapy, but I also get to explore other things I'm interested in, like research or designing trainings or things like that. That's
amazing. And I think that is just a problem we have in society in general. Exactly. Feeling burnt out. When can I take my next break? When can I go on vacation? When's the weekend coming? But working with and understanding how people work best can be so much more productive. Absolutely.
And I think, you know, it's not just adults who get burnt out. Kids, we get burnt out
from
too.
School, from everything.
Exactly.
And that, you know, that actually kind of leads into the phrase autistic burnout. What does this mean exactly? How does this look like for our kids? For, you know, kids and adults, it'll probably look a little bit different. The idea is that, like, yes, people experience burnout, and usually it's something that, like, if you take care of yourself, it gets better, right? With autistic burnout, it's usually chronic. It's been building up for a while. Your whole system has, like, shut down and can no longer cope with what it could before. So a lot of times it might look like loss of skills that you previously had, right? Maybe it becomes really hard to even, like, book an appointment or brush your teeth, or things that came a little bit easier before are just no longer available to you. Maybe it's being super overstimulated. Before, you maybe had the ability to regulate or to say like, oh, I need to put on my noise canceling headphones right now, or that smell is too strong for me. You start to lose the ability to kind of advocate for yourself. And so that can be another way that we understand, you know, children's needs, is like, when this, other people might say, oh, they're having a tantrum. Well, what needs are going unmet for them right now? Exactly. What are they telling us?
Exactly.
We need to be detectives.
Exactly. So a lot of times it's realizing that, again, I think for kids, we don't think about that as much. And you know, adults, it makes sense. And also remembering that, like, kids, when I think about a kid's school schedule, I'm like, how do they do that?
It's terrible.
Like, I don't think I could go back and do that for, like, you know, 6-7 hours a day. I want to believe that, like, people are doing the most they can in the places that they're at, right? So it's really about, like, if there's a system that's not working for someone, do we need to change the system, or does that person need to find another place?
Absolutely, And, of course, that being said, it, of course, can be hard for people to be like, okay, you know, I can't necessarily pull my child from this school, so, you know, what can schools now do? I hear you provide trainings, and I know that there are other therapists who also will go into schools and say, hey, this is how we can be accommodating. This is what we can do to help. Like, if they need to sit on a bouncy ball, that's okay. That's
some places are more receptive than others.
Some places, yes, exactly. So it very much differs for sure. And, you know, speaking of, like, some of the things I get to do outside of my job, that's one thing that I love doing. I love teaching. So I do go to schools and offer trainings, like, how can you support your neurodivergent students? How can we support neurodivergent staff? How can we create more neurodiversity affirming practices here? But I also do that for companies. So I'll go in and say, like, how can we manage employees in a way that's going to be most affirming of their neurotype? Or for employees, how can you help advocate for your needs? Or I'll provide a scaffolding for, like, here's this exercise you can do for yourself, and here's how you can talk about it with a manager. So I think that's one thing that I get really excited about too. And I offer trainings for clinicians, because for marriage and family therapists, at least, we don't learn about
we don't learn a ton about autism or other neurodivergencies in our grad school programs.
Right.
So most of my training has been after grad school.
Yeah, absolutely.
And now I'm able to provide that for other people, to give them some of those trainings so they can, I also do it for parents. So any kind of work that's around how can we better understand autism, how can we better understand ADHD, those are the main ones I focus on, but that's not like an exhaustive list
of course,
by any means.
Right.
And so that's a lot of what I'm passionate about, and I'll do those with trainings with parents, therapists. That's and it's awesome. Kind of like I have like a base one, and then it's like, what's going to work for you?
Yeah. And I know that it is so different everywhere you go, every, individual you're with or group that you're with, it's so different. Do you have examples of what you might talk about when you go to these trainings or go to a school or, even with parents?
Yeah. I'm sure with parents will probably be the most relevant for y'all, so I can talk a little bit about that. A lot of these are going to be, here are the basics of here's what neurodiversity means. Here's what neurodiverse means. Here's what neurodivergent means, right? Because those are like different terminologies. Here's what autism looks like, right? Historically, maybe we treated autism in this way, which is kind of what I talked about earlier, deficiencies. Now there's a way to look at it where we say, what are the strengths and what are the challenge areas? A lot of it is unpacking and helping people understand, like, here's a way to look at autism in which your child is not a problem that needs to be fixed. But instead, like, how can we help understand them? And a lot of times when people start exploring for their child who's autistic, they realize, wait, I think I might be neurodivergent too.
Yep.
That happens a lot for people. And so, a lot of these, like the parent trainings are exploring things like that. And then what we would call, for some children, they're maybe really demand avoidant. Or they have a really, we would call like a persistent drive for autonomy and independence, and really sensitive to power and control dynamics. So we might explore like low demand parenting. How can we help your child to feel more empowered? So those are like some of the examples of what they would cover.
I hear you. And I think in my therapy experience, autonomy is something we always are striving for in some capacity, like, just because it's not a good feeling when you feel like you have no control for anybody, and that includes children. So I
think a lot of what children get taught is that you have to listen to an adult, for example, and you can see how it leads to vulnerabilities when we say, well, okay, there's some adults you should listen to, but there's some you shouldn't, right? It's very confusing.
You're like, what does that mean?
I think it's like really valuable to teach kids discernment and again, advocacy, to say, like, something doesn't feel good for you and for your body, how can we help you vocalize that? Even if sometimes that thing is like something that has to get done, like brushing your teeth, or all your teeth are gonna fall out. But how can we at least
fear tactic?
How can we at least put words and help you say that you're allowed to talk about how that's uncomfortable for you, and maybe we still have to do it.
Listening and hearing. It's a lot about just being good listeners, I feel like, and understanding that if someone is feeling something, if there's a tantrum, outburst, whatever that a young child's having, it's maybe because they can't communicate what they need. That's a lot of where, like, my overlap would go in, working with an occupational therapist, for example. They might be looking for sensory needs. What is the child seeking? Where can we support the child? And then the communication aspect of, okay, why is this happening? What does the child need to express themselves?
And then, like, where do they thrive? And where do we see them thriving already? And what's contributing to that? Absolutely.
I totally hear that. That's amazing. All right. So, Mady, it has been so wonderful talking with you, and I really appreciate you sharing everything that you have with us and all of your insights. And I'm wondering, for parents, caregivers, other therapists who would maybe want to talk to you, how can they reach you?
Thank you. And thank you for your time and thoughtful questions.
Absolutely.
Too. If people want to get a hold of me, they can reach me. Probably the easiest way is at my website, which is my first name and last name, MadySnyder.com. And there they'll find a lot of information about me. You'll also see a page that I list my own values there. Perfect. And if I might be someone who that would align with for you. So they can reach me at that website, and there's a link to reach out to me there. And you can also see any of the trainings that I'm doing. So if people are interested in checking some of those out, they can check that out on the website as well. I offer in-person therapy services in South Pasadena and also virtually in all of California. So even if someone's in California and they're not in the LA area, they can also reach out for virtual services, which tend to be a good fit for a lot of people.
Yes.
Who have busy schedules.
Absolutely. Yeah. Well, I know from experience, Mady's website is wonderful. It's how we found her. She's amazing. So go check that out because you have a lot of great information there. I really appreciate all your time.
Of course.
Thank you for joining us. We will see you next time on Feeling the Love with Big Heart Toys.